It's one of those really common, frustrating mysteries. That weird numbness or tingling, or maybe just a dull ache that shows up in your arm and hand. For some, it's just a little annoyance, but for others, it can really start to mess with your day to day life.
So maybe you wake up in the middle of the night and your hand's completely asleep, or you feel the strange ache deep in your forearm after you've been typing all day. These are the classic signs that send people looking for some real answers.
And of course, the minute you start looking for those answers, one name pops up everywhere: carpal tunnel syndrome. It's the most famous culprit, right? The number one suspect in our little diagnostic investigation.
But what if the obvious answer isn't the right answer? What if the evidence doesn't quite fit? Well, today we're going to play detective and follow the clues to uncover what's really going on because a lot of the time, the first guess isn't the whole story.
All right, so let's kick off our investigation with the usual suspect: carpal tunnel syndrome, or CTS.
So, what's actually happening with CTS? Well, it's all about the median nerve getting squeezed or compressed right at the wrist, inside this little pathway called the carpal tunnel. And this creates a very specific pattern of numbness. It's like the nerve's own personal fingerprint. It almost always affects the thumb, the index finger, the middle finger, and about half of the ring finger.
To figure out if CTS is really the villain here, clinicians have this whole toolkit of what they call provocative tests. And the goal is pretty simple. They want to temporarily increase the pressure in that carpal tunnel to see if they can trigger your exact symptoms. It's kind of like an interrogation for your nerves.
Okay, first up in the interrogation room is the Phelan's test. You hold your wrists in this really bent, flexed position for about a minute. What you're doing is basically squishing that carpal tunnel space. If that familiar tingling or numbness comes rushing back, that's a really strong clue pointing straight at CTS. All right, next up, we've got the Tinnell sign. A clinician will gently tap right over the median nerve at your wrist. Now, if that nerve is already irritated and compressed, that little tap can send this zinging, pins and needles feeling shooting down into your fingers. It's another classic piece of the puzzle. And then there's maybe the most direct approach of all, the carpal compression test, which is also called the Durkin test. Here, someone just applies firm, steady pressure right on top of the carpal tunnel. And this one is often considered the most sensitive of the bunch, especially if you're in the early stages of CTS. Okay, but what happens when all these tests come back negative? Or maybe the symptoms just don't quite match that classic CTS pattern? Well, that's when a good detective knows you have to widen the search area and start following that nerve trail upstream, away from the wrist. You see, the median nerve isn't just some short little road in your wrist. No, it's this long neurological highway that starts all the way up in your neck and travels down to your hand. The carpal tunnel, that's just one well-known spot for a traffic jam. There are plenty of other places along the route where things can get backed up. So let's look at one of the most common imposters, pronator syndrome. This is where the same median nerve gets pinched, but it happens further up in the forearm. A huge clue here is where you feel a numbness. Unlike CTS, which usually leaves your palm alone, pronator syndrome can make the very center of your palm feel numb. Plus, you'll probably feel more of a deep, nagging ache in your forearm instead of just wrist pain. And you know what? Sometimes we've been chasing the wrong nerve entirely. The problem might actually be the ulnar nerve, which loves to get trapped at the elbow. This is called cubital tunnel syndrome. And just look at the symptom map. It's totally different. It affects the pinky and the other half of the ring finger, a completely different pattern from carpal tunnel. So how do we check for this? Let me ask you something. I want you to imagine you're pinching a piece of paper between your thumb and the side of your pointer finger, kind of like you're holding a key. Now, can you do that and keep your thumb perfectly straight? If your thumb automatically bends at that last joint, you might have what's called a positive Froment sign. See, the muscle that keeps your thumb straight for that strong pinch is powered by the ulnar nerve. When it's weak, your brain does this clever little workaround. It recruits a different muscle, when it's powered by the perfectly healthy median nerve, to finish the job. But that muscle makes your thumb bend. It's a fantastic clinical sign that points the finger right at the ulnar nerve. Okay, but now we get to the biggest plot twist in our entire investigation. What if the problem isn't a simple pinch, not just a traffic jam on one single nerve highway? What if the body's entire signaling system has just gone haywire?
This is where we run into a condition called complex regional pain syndrome, or CRPS for short. And this has nothing to do with one compressed nerve. It's a massive overreaction by the body, where the pain response to some kind of injury is just completely out of proportion and lasts way too long. The symptoms spread out in what's called a stocking glove pattern. It doesn't follow any single nerve map.
And believe me, the visual clues here can be absolutely dramatic. We're talking about major swelling, skin that looks shiny, and big changes in color and temperature when you compare it to the healthy limb. This is your body's nervous system just stuck in overdrive, and it causes changes that go way beyond a simple pinched nerve.
And here's one of the most fascinating and kind of weird clues for CRPS. It has to do with a person's own mental map of their body. When someone with CRPS is asked to draw their body, they might sketch the affected arm or leg as way too big or tiny, or even looking like it's not attached. This shows us that CRPS doesn't just affect the limb, it actually affects the brain's very perception of the limb. So, the big takeaway here is that CRPS is this whole collection of symptoms. The pain is way out of proportion to whatever caused it. Even a light touch can feel incredibly painful. That's called allodynia. And when you see all these other system-wide changes, like with swelling, skin, hair, and nails, you know you're dealing with something much bigger than a simple nerve compression.
All right, so after all that detective work, how do we actually put all these pieces together to crack the case and figure out what's really going on in your body?
You know, there's a quote from the source material that just nails it. It says that every component provides a piece of the diagnostic puzzle, but no single test should be looked at by itself. And that's exactly right. There's no one gotcha test. It's all about assembling a puzzle. So let's pack your detective's toolkit with the key takeaways. First, remember that a diagnosis is a puzzle, not just one clue. Second, if your symptoms go up above your wrist, there's a good chance the problem is starting higher up your arm. Third, pay super close attention to the pattern of your numbness. That's your critical map. And finally, you have to put all of the evidence together to get the full picture and solve the case.
In the end, all of these symptoms, the tingling, the ache, the numbness, they're just messages. So the real question isn't just, what's my diagnosis? It's, what is my body trying to tell me? And being an active, curious detective in that investigation is always the best first step to finding the right answer.